and also opened up these massive sites like State Farm Stadium that have rolled out many, many more shots than what we were seeing at first. In fact, at this point, we're actually one of the fastest states to be rolling out our vaccines. 700,000 doses is a lot of doses, especially when the priority population in Arizona is about 3.5 million. So we're making our way there. And as we get more supply in, we're going to see more openings. But clearly, this does fall on the state. The state has a responsibility to work with its counties and work with other health leaders to make sure this process is communicated well, is rolled out well. And in the end, it will fall on the state to make sure this gets done correctly, because that was dictated from the federal government that the states are going to work with their counties to roll out this vaccine. Now, everybody plays a part. The population, us citizens, play a part in helping each other get signed up for these appointments. Older folks are going to have trouble online. So it's on us to help our neighbors and our family members who may not know how to navigate those websites fully to get them those appointments they need. But in the end, yes, the state is going to have to answer for any faults that we have during this process. But right now, we are on track and we are doing much better than we began doing.
Okay, that's a good point too, Cameron. Each of us plays a role. I want to get to another question from Bruce and Annie Anderson. They say, we have appointments scheduled for the Phoenix Municipal Stadium. We're confused about the age requirements, though. We are 71 years old. Part of the DHS website says it's only 75 and over in Maricopa County, but another part of the website says 65 to 74 is okay at the state-run sites. So are we okay for our appointment? And are they taking 65 to 74 years old at these two state-run sites? Can you kind of clear it up for us?
Yeah, Nick, this was a little confusing, right? So 1B didn't initially include 65 and older. However, the federal government, the CDC, all recommended that states open it up to 65 and older, because we know those with underlying health conditions and those who are older than 65 are more prone for the more serious effects of this virus. So when the state opened it up, I think it was about three weeks ago, about 3 weeks ago, the state announced that 65 and older would be available in that 1B priority group. Included in that 1B priority group, we're talking about educators and child care workers, law enforcement, age 75 and older, 65 and older. Those are the folks that we're really focusing on in this priority group. And yes, you are included in that. You can go to State Farm Stadium. You can go to Phoenix Municipal. In fact, you can also enroll in Maricopa County if you're 65 and older, if you can get an appointment. Obviously, they're very limited in Maricopa County. I would suggest jumping on the website at 9 a.m. and trying to snag one of those new appointments at Phoenix Municipal Stadium.
All right, Cameron, last question comes from Myrna Brown Forte in Pinal County. She says, I'm a long-haul semi-truck driver delivering food products to all the 11 western states. Of course, we thank you for what you're doing right now, an important job. She says, I'm 67. I'm an African-American female in Phase 1B. Every time I try and get a vaccine appointment, there's nothing available. Yet on the news, I hear vaccines are available at certain sites. I'm on a few of the waiting lists and still haven't received notification from anywhere. I live in Pinal County. I travel to many different states, and because of the variants, I am extremely concerned. So a couple different issues here, Cameron, but what would your advice be to her?
Well, I was lucky enough to speak to Myrna yesterday. She's an amazing lady who's waiting to see her great-granddaughter for the first time, who was just born. She wants to get that vaccine, not only to protect herself in her job in delivering food to our communities, but also to get to see that family member that she's yet to meet in person. What I can tell you is Pinal County, like many of the smaller counties, are limited in doses. They are getting smaller allocations because it's based on a per capita basis. Obviously, it's tough when you live in these smaller counties and you see larger counties like Maricopa County or Pima or these state-run sites just delivering vaccine after vaccine. Now, the one great thing Myrna did is that she actually put herself on a waiting list. And yesterday,